Thank you for watching. This is YouTube Medical University. Now please look at this foot picture. Here, the blood vessels in the foot are standing out like a spider web. In Eastern medicine, this is called sairaku. In Western medicine, it is known as varicose veins. Actually, these varicose veins not only change appearance, but if you miss the early symptoms and they progress, you may end up needing surgery, or you could develop deep wounds called ulcers on your legs, which can then become infected. In severe cases, you might need leg amputation. This disease can cause serious complications. I can't believe these symptoms were varicose veins. If I had known earlier, I could have noticed. To help you avoid this time I'll talk about the early symptoms of varicose veins in the legs and the dangerous complications that can occur as the condition progresses. And of course, it's best not to get varicose veins in the legs in the first place, right? So at the end I'll also introduce some unexpected ways to prevent varicose veins in the legs. A report shows that doing a specific action for 5 minutes each hour during desk work boosts leg blood flow. Please listen through. At YouTube Medical University, as an active physician, I share videos to help you get healthier starting tomorrow. I'd really appreciate it if you could subscribe to the channel so you don't miss any new videos. So, here's today's agenda. In the first section, I'll talk about what varicose veins in the legs are, who is at risk, whether some people are more likely to get them, and if there are any genetic factors involved. I'll be covering these topics. Then, in the second section, I'll introduce 3 early symptoms of varicose veins in the legs. In the third section, I'll talk about 3 dangerous complications that can occur when varicose veins progress. And finally, in section 4, I'll discuss treatment and prevention of leg varicose veins. Let's begin the first section. What type of disease are leg varicose veins? It's simple. Our body sends blood flow throughout the body from the heart. The blood vessels that carry blood from the heart are called arteries, right? And the blood that passes through those arteries and returns to the heart does so through the veins. This time, the varicose veins refer to lumps in these veins. Ryu means bump or swelling, right? When a blood vessel swells up like this, it's called a varicose vein. Why does this happen? It's clearer if we consider who is most likely to get it. People who stand a lot at work or do heavy housework are more likely to get leg varicose veins. Childbirth or wearing a corset for back pain also increases the risk. It's common among these people. What they all have in common is that pressure is put on their veins. People who stand a lot for work, like hairdressers or supermarket cashiers, tend to have poor blood flow in their legs, which are at the lowest point due to gravity. And pregnant women also experience pressure because the baby in their belly compresses the veins inside, making it difficult for blood to return from the legs to the heart due to the high pressure. People who wear corsets have the same issue. When the pressure inside the veins increases, as shown in this image, the blood vessels bulge out. Normally, our veins have valves that open and close to prevent backflow and help blood return to the heart. However, when the pressure increases and the blood vessels bulge, the valves can get damaged, causing the pressure to keep rising more and more. This image shows the blood vessels swelling vertically, resembling a string of beads. Considering the reason may make it clearer. In other words, varicose veins often develop in those who have worked hard or experienced childbirth, and are sometimes seen as a badge of honor. As a guideline, people who have been standing for more than 6 hours a day are said to be at high risk. A Danish study found that people standing over 6 hours daily compared to those who don't. There is a report that their risk of varicose veins was as much as 1.75 times higher. It is said that 2 out of 3 people over the age of 70, about 75%, have varicose veins in their legs. So, everyone watching this video, please check your own legs and see if you have any veins that look like spider webs or any bulging veins sticking out. Now, in the second part, I will explain what kind of symptoms appear in your legs when these varicose veins develop. Symptoms like swelling or other issues may be caused by varicose veins. Many patients at my clinic felt much better and saw their symptoms disappear after varicose vein treatment, so pay attention to these related symptoms. One main symptom of varicose veins in the legs is leg cramps, also called komuragaeri in Japanese. Many people suffer severe, unbearable nighttime leg pain from these cramps. Do any of you experience this? It could possibly be caused by varicose veins. Leg varicose veins can lead to this kind of problem. Leg cramps tend to occur more often in the early morning. Also, sometimes your legs feel heavy and you can't sleep without a massage. Some people complain of vague leg heaviness. Many patients experience this and many report their symptoms improve after treating varicose veins. These common symptoms are known as early signs of varicose veins in the legs. And since many people get better with treatment, please be sure to listen to the treatment methods that I will talk about in the fourth period. I've previously released a video about leg cramps on YouTube Medical University. Leg cramps can be caused by various symptoms other than varicose veins, and there is actually data showing that a certain stretch can improve leg cramps. If you're interested, please check out the video from the link in the description below. The second main symptom of leg varicose veins is changes in leg color, especially in women. Varicose veins in your legs can be a cosmetic concern, but that's not the only problem. If varicose veins are left untreated, your legs can develop a reddish-brown discoloration. This is called pigmentation. When blood vessel pressure rises, blood slowly leaks through gaps in the vessel walls. When that happens, a substance called hemosiderin contained in the blood accumulates in the tissues. This change doesn't appear suddenly, but rather happens gradually and slowly, so it's hard to notice it yourself. However, as time goes by little, the color turns reddish black or brown, and if the cause isn't treated, hemosiderin keeps building up. The discoloration may persist or even worsen. This is the third symptom of lower limb varicose veins. It's swelling in the legs. For those of you who usually study at YouTube Medical University, you might have learned that swelling in the legs happens when the heart is not functioning well, but actually it can also occur with varicose veins in the lower limbs. Why does this happen? If you watched the first lesson, you probably understand. The internal pressure in the blood vessels increases and fluid gradually leaks out from the vessels. As a result, fluid keeps accumulating in the legs, causing swelling to appear. For those who have varicose veins and experience leg cramps or swelling, it's possible that the varicose veins are the cause, so I recommend getting an examination to assess the severity of your leg varicose veins and if treatment is needed. For those who want to get tested, I recommend this examination. It's called a lower limb vein ultrasound, where we use ultrasound waves on the blood vessels to check if the veins are actually enlarged. There's no pain, and it's a very useful test. If this test suggests treatment is needed, consult the vascular surgery department. However, lower limb vein ultrasounds are often available at regular internal medicine clinics, so check their website or contact them for details. Let's review what we've covered so far. It's said that 2 out of 3 people over the age of 70 develop lower limb vein issues. When the pressure in the veins, which are the blood vessels returning blood to the heart, increases, the valves stop functioning properly. It leads to a condition where the blood vessels become swollen and bulge out. And I explained that symptoms include leg cramps, discoloration of the legs, and swelling of the legs. At YouTube Medical University, we offer clear information, including explanations of causes. Nowadays, we are surrounded by all kinds of information. While much of it is useful, some of it is actually incorrect. At YouTube Medical University, we explain things in a way that helps you avoid being misled by incorrect information. So if you subscribe to our channel so you don't miss any new videos, it would really encourage us. Now, in this third period, I'd like to introduce 3 dangerous complications that can occur when varicose veins in the lower limbs progress. The first of 3 lower limb varicose vein complications is stasis dermatitis. If you understand the cause, this should make sense. Stasis means that blood flow is stagnating. Varicose veins are caused by stagnant blood flow. Stasis dermatitis also results from varicose veins causing blood flow to become stagnant. The blood vessels supplying the skin of the legs no longer get enough blood. When the legs don't get enough blood flow and nutrients, they become inflamed. As a result, as shown in this image, the legs can become red and swollen. Itchiness may occur, and if the inflammation repeats, the skin becomes hard like an elephant's leg. Such changes can also occur. The legs become hot and pain appears as well. And once it gets to this state, there are many patients who suffer from stasis dermatitis repeatedly. Consider the preventive methods and treatments I'll explain later to avoid this condition. The second of the 3 main complications of varicose veins in the lower limbs is this: thrombophlebitis. Thrombophlebitis. That sounds like a difficult name, doesn't it? But if you think about the reason, it's not that complicated. As I've said many times, varicose veins are when the blood flow in your legs becomes stagnant, right? When blood flow slows down, the blood gradually starts to clot. When you get a cut on your hand, you bleed, but that blood gradually clots, right? In the same way, when blood stops flowing, it gradually starts to clot. That's how it works. In other words, when the blood flow in your legs stagnates and circulation slows down, blood clots start to form. When this happens, blood flow slows further, inflammation may occur, and your legs can become painful, red, and swollen. Have you heard of economy class syndrome? It's when limited leg movement on a plane slows blood flow in your legs. This causes blood clots to form, which may travel to your lungs. It's a scary condition, but it's caused by the same thing, poor leg blood flow. You might be surprised to learn that varicose veins in your legs can also cause blood clots. I think many of you didn't expect that. The third complication of varicose veins in the legs is the development of ulcers on your feet. Please take a look at this image. There's a deep wound on the foot called an ulcer. As you can see, it's painful. And once it develops, it's very difficult to heal. Why do these wounds suddenly appear on the feet like this? It's because the blood flow in the legs gets worse and nutrients can't reach the area properly. This happens as a result. All the cells in our body are alive. If the blood flow stops, it eventually leads to necrosis, which means the tissue starts to rot. When varicose veins block blood flow in the legs, the skin lacks nutrients and begins to die. Ulcers can develop as a result, and since these ulcers are wounds, bacteria can enter through them, which often leads to further skin inflammation. If that happens, it's tragic. Sometimes antibiotics help, but in the worst case, the wound worsens and the whole leg can become gangrenous. That can happen, so before it does, consider the treatments and prevention methods I'll discuss next. Thank you for waiting. Next, I'll discuss leg varicose vein treatments and some surprising prevention methods. The main treatments for varicose veins in the legs are: the treatment method is called conservative therapy, which means relieving symptoms like swelling and cramps in the legs without surgery. Compression therapy is used for this purpose. There are treatments such as wearing compression stockings, which apply pressure to the legs, or using elastic bandages to wrap the legs and provide compression. This makes the legs firmer and restores normal vein pressure. This makes it easier for the blood that was stagnant in the legs to return to the heart. By wearing elastic stockings and similar items, cramps in the legs improve and swelling gets better. Many patients experience this. Medical elastic bandages and similar products are quite effective even without surgery, so I definitely recommend giving them a try. However, in summer, they can get stuffy, and putting on elastic stockings is often surprisingly hard. Because of this, many people buy them but rarely wear the stockings. If you see little improvement after these treatments, surgery and other options may be considered. As for treatment methods, they actually remove or strip out the veins affected by varicose veins. And there are various treatments developed, such as injecting medication to harden the veins or using lasers. However, it's not necessarily recommended that everyone with varicose veins in the legs undergo these procedures. These treatments also have disadvantages, so they are mainly recommended for people with very severe symptoms. If your daily life is affected or symptoms worsen, consult your doctor and decide together whether to undergo treatment and which treatment to choose. Treatments are available on an outpatient basis. If you're concerned, I suggest getting a leg vein ultrasound to assess how advanced your varicose veins are. You can have this done at your regular hospital or at a facility specializing in vascular surgery. Now then, you've been waiting for this. While we've talked about the symptoms and dangerous complications of varicose veins in the legs, it's best not to get them in the first place, right? And it's also very important to make efforts not to let existing varicose veins get worse. It's very important to prevent the progression and to take action at the pre-disease stage before the illness actually develops. At YouTube Medical University, we share preventive health knowledge not often covered in hospitals, so subscribing would greatly encourage us. What are some ways to prevent varicose veins in the legs? I'll introduce 3 effective methods. Here is the first of the 3 prevention methods for varicose veins in the legs. It's to walk for about 5 minutes every hour. This is based on a study conducted in 2019. Data shows the group walking 5 minutes every hour had better leg blood flow than the group that didn't. When you do a lot of desk work, your legs are always hanging down, just like when you're on an airplane, which makes it easy for blood flow to become stagnant. Please, it's very important to get up every hour for about 5 minutes to take a walk, get a drink, or use a standing desk to avoid sitting for long periods of time. There is also something called the Edinburgh Vein Study, which shows that people who exercise regularly for just 30 minutes a day have a 25% lower risk of varicose veins compared to those who don't. Exercising for 30 minutes daily and walking 5 minutes each hour can greatly lower your risk of varicose veins. This is the second of 3 recommended prevention methods. Elevate your legs. It's simple. Sitting at a desk with your legs down increases the risk of varicose veins. On the other hand, if you sleep with your legs elevated, your legs will be higher than your heart, so blood flow will follow gravity and return to your heart more easily. By doing this, it's said that you may be able to prevent varicose veins. And another thing, from the perspective of returning blood flow to the heart, it's also considered effective to strengthen your calves. The calves are called the second heart. When the calf muscles are large and contract, they moderately compress the veins, which helps return blood flow to the heart. So, exercises that focus on the calves, for example, raising your heels like this, can strengthen the calf muscles and may ultimately help prevent varicose veins. Try standing on your tiptoes while cooking. Place a footrest under your feet while doing desk work. These small daily habits can help prevent dangerous complications in the future. Please try at least one thing that you think you can do yourself. The third way to prevent varicose veins is to relieve constipation. Earlier, I mentioned that pregnant women and corset wearers are more likely to develop leg varicose veins. This is because increased abdominal pressure raises the pressure in the abdominal veins, making it harder for blood to return from the legs. In other words, chronic constipation can also cause increased abdominal pressure, so preventing constipation is thought to help prevent varicose veins in the legs. Therefore, surprisingly, consuming a lot of dietary fiber may be an effective way to prevent varicose veins. What I especially recommend is soluble dietary fiber. It's found in abundance in sticky vegetables. It's found in foods like wakame seaweed, grated yam, okra, and also in natto. This soluble fiber helps prevent rapid blood sugar spikes. It also works to soften your stool, making it easier to pass. Please try to include it in your daily meals. Let's recap. In the third period, I discussed 3 complications of progressing lower limb varicose veins: stasis dermatitis, thrombophlebitis, and ulcers. If you're wondering what kind of diseases each of those were, please review the third period. In the fourth period, we discussed compression therapy as a treatment for lower limb varicose veins, like wearing elastic stockings or bandages. I explained that treatment options include removing, hardening, or laser cauterizing varicose veins. And finally, as preventive measures, I introduced walking for 5 minutes every hour, exercising for 30 minutes a day, strengthening your calves, sleeping with your legs elevated, and preventing constipation. Weren't there many surprises? I hope you'll listen repeatedly and review as much as possible. Please share in the comments the symptoms you've had, those of your friends or family, and your usual preventive measures. I'd love to hear from you. I think your comments will help other viewers, so I'm looking forward to them. As for this video, whether it's a thumbs up or a thumbs down, please rate the video. It will help me improve the next one. I know I've said this many times, but if you subscribe to the channel, it really motivates me to make more videos. I'll see you in the next video. I'm a general practitioner, and my patients have taught me how to live agelessly from your 70s onward. It became an Amazon bestseller in 4 categories and topped the gift rankings. I've compiled into one book the important ways of living and health methods that I've learned from my patients while working as a doctor. This book makes you think, I want to live a healthy life too. It's on sale and getting great reviews, so check it out.